watching pertussis cases in the buildings and watching the Olympics going on and just really crossing our fingers that we could get through it without COVID coming to our community, and we were able to do that. But our students last year lost the end of their junior year and now the bulk of their senior year. So we understand the importance of these things to them and are looking forward to finding something that everyone can be happy with. And then finally, we've got a bigger update on athletics. I think especially at the high school level, any of you with children in athletics, winter athletics in particular, have probably been very tuned into this issue. So the governor and state health department did approve for schools to go ahead with high-risk indoor winter sports pending the guidance from the local section and the local health department. So I'll be honest, I'm very nervous about it. I'm just going to put that out there because right now, we know there's a lot of new variants. Coming indoors has certainly been more challenging for us on the spread front, especially at the secondary level. That being said, the county is approving it. And again, Dr. Ambler, our county health department director, is doing that with some level of anxiety, but our county partners, our county executives from the region that are covered by Section 1 met to try to come out with plans that are very similar to one another, because as a region and as a section, the more we can be consistent, the easier it's going to be for us to navigate this. So they did announce their approval of high-risk sports, and part of the process then comes down to the district and the board to put a couple steps in place. So just by way of letting folks know where we've been, we've had open gym since January for our winter sports. We knew that there was going to be discussion. We were hoping things, we were waiting to get guidance, and in those intervening weeks, the teams were meeting just for open gym practice, kind of an off-season sort of practice, and that was just students at the varsity level. They were using all the normal screenings that we use for students who come in to school in the morning, the screening protocol, temperature taking, et cetera, and following masks and distancing protocols. Section 1, as I said, did approve from their perspective for districts to start high-risk sports on February 1st, pending county and board approval. We received the guidelines from the Westchester County Department of Health about 8 o'clock last night, so Mr. Hodge, our athletic director, has been scrambling throughout the day to get things put in place. So one of the items the board will see on the agenda tonight is actually one of the requirements that the county provided, which was that the Board of Education approve, or superintendent in this case, I thought it appropriate to bring to the board, to approve a resolution approving high-risk sports. Those sports include ice hockey, boys and girls basketball, cheerleading, and volleyball. We are looking to approve those at the JV and varsity level. We're not looking to implement modified sports at this time. Most of those sports will start now, as of this week. Volleyball is not slated to start until March 1st. So just so you know some background. There was a little bit of discrepancy between the state guidance, the New York State Education Department guidance, and our Westchester County Department of Guidance regarding physicals. The state had given some leeway on physicals. Department of Health wants physicals in place. So even as we speak, that clarification is getting worked out between the two entities. We are going to be moving forward, expecting students to get physicals in place and up to date until we hear otherwise, given the variety of health concerns with COVID and with athletes. As we move forward, we are certainly going to continue implementing our daily screening, mask protocols, et cetera. We will not be using locker rooms. Students are just going to be expected to come ready to play. And that's really, we haven't been using our locker rooms all year as a way of reducing opportunities for spread. If we have guests coming in for games, they will have to have temperatures taken at the door and come with screeners, those same screening questions that our students bring to school each day, and there will have to be a pre-approved list coming. One of the pieces that went into play today, we had planned on starting practices today, but again, with the guidelines that came out last night, students are required to sign off on a code of conduct This was a requirement by the Department of Health because, again, there are concerns about doing high-risk sports indoor during a pandemic at this moment in time. So they wanted to be clear that students and parents were very clear about the risks that they were undertaking. So they provided for us a code of conduct, which was distributed to athletes today. So our teams came in, met with coaches, got the required paperwork, and they'll be, once that's returned and the physicals are in place, they will be beginning play. I did put an attachment on the board meeting tonight, because that is required to be part of the resolution. I will add, there will have to be one adjustment to it. There is a requirement that students also, if a student and Julia, help me if I get this wrong, if a student has had COVID, they need, in addition to the form, in addition to a physical, they need a cardiovascular evaluation by a doctor to be approved before they can start practicing or playing. So that needs to be added to this form, but I didn't have that on there, so I'm going to ask when we get to that tonight that we approve this form with the correction as noted in my report. So that form was given to our athletes today, and once those are in and all the paperwork is in place, they will begin practicing. Yes.
What about testing?
So testing is definitely something we've been talking about. We did not include testing in the board resolution tonight. That being said, we want to implement testing. We just didn't want to necessarily have it written in there. So Julia has been working for a number of weeks to have a testing plan in place if we had been identified as a yellow zone or a red zone. That's not the case now, but because of that good work, we are in a position where we're looking to implement surveillance testing as soon as possible. So potentially in the next week or two. And to be honest, we don't want to do that just with our athletes. We want to do it certainly for these athletes, but we want to be able to put that in place systemically. So we're going to be finalizing plans in the next few days and requesting the free Buy Next Now cards from New York State. Our nurses, Julie's been working with them to get them trained and ready so that we can put basically a regular weekly system in place for testing of our athletes as well as testing of our general population of students and staff, which we think is actually going to be a tool that's going to help us down the road as we work towards reopening of schools. So thank you for asking that. It was one of my upcoming things.
Can I ask a question about the code of conduct?
Yes.
So it looks like a more kind of high school specific code of conduct similar to the pact that we all signed as families and students at the beginning of the year. Is it going to be enforced in the same way? Like, unfortunately, times we've been sent pictures, right, and you've had to act on it. Like, how is this going to be?
Yeah, and I think that would be the same thing if the school or Mr. Hodge becomes aware of a student not adhering to the code of conduct, then they would be removed from practice, removed from games, removed from the team. My guess would be temporarily through a quarantine period, most likely. Yeah. I will note, too, when it comes to positive cases, what we've been told, and again, Julia, tell me if I'm off base on this, that if a student or a coach, anyone on the team does test positive and they were at school, the whole team is going to have to quarantine. So again, that's just another piece of, as we do add more things into the system, that's what Department of Health has told us at this point. Whether it's a coach or a student, if they're at school and expose others, then the whole team will have to quarantine.
So, the team you're playing against, as well as your opponent, their whole team too.
Right. If it was a game, you're exactly right. Yep. So if it was just a practice, then it's only our team. If it was a game, then we're looking at teams from both schools.
And actually, that was consistent with the fall sports that were outside. They did the same thing.
Yes. Correct. Yep. So the one other piece that I think is worthy of note, with this approval, the Section 1 did decide that we were not allowing spectators at this point. And to be honest, a lot of that comes from just capacity to contact trace. It's 4 hours, 3 to 4 hours, anytime we have an in-school, especially at the middle school or high school. That's just for one case in the middle school or high school. If we've got athletics, that's an additional new venue that we're having to contact trace in. So to have to contact trace adults and spectators really is just beyond what any school has capacity for. So that, I think, was the large thinking behind Section 1's decision. We support that decision. They are, though, allowing 2 family members to come for senior night, which we thought is important. So that's great. And I think Mr. Hodge's plan is to have the first home game be senior night. So he'll be putting information out about this, but also to kind of fill that void, because we know that families and students are going to want to watch sports as they play. So Jim in his office are in the process of working with Mr. Hodge to set up Varsity Media as a streaming service, so that we'll be able to stream our varsity games. And I don't know how quickly we're in process, so I don't know how quickly they'll be here, but we're hoping that by the time games get up and running, that we'll have that service available. And that should be, from my conversations with him, any of the sports, any of the indoor sports, so the ice hutch here at the school, yeah, any of the games and competitions that are home games, we will be streaming through Varsity Media.
It's a pretty great option. I know some school districts have had that pre-COVID, so it's
Yes.
a good option if you have family who lives
Yeah.
elsewhere and they want to watch the game.
Yeah.
Maybe a
Yeah,
takeaway
and that's
after
something,
this.
that's something that he had been thinking about even before winter sports came on the scene. But I think you're right, it's something that we may, once we get into a system that we like, we may, maybe one of those COVID things that stays
One of the
afterwards.
positive morsels from all this.
Definitely. So any questions about athletics? Okay. You know, and I think that's a good lead into our next topic. And I'll be honest, I completely recognize the mixed message that sends. Let me just put that out there, because I recognize that too. And as I said, I'm personally pretty nervous about it. The health professionals at the county are pretty nervous about it, but they recognize the value of sports, so they're trying to provide some steps forward. But I do recognize that does seem a little contradictory, some of our practices. To be honest, we want to take a measured approach to how we take steps forward. So right now, the section has decided, the county's decided we're moving ahead, so we're moving ahead. This is going to be a first test for us, and again, another reason to get surveillance testing in place so that we can measure, is there an uptick because of this? The county executive has already said if he does see numbers going in the wrong direction as a result of sports, he himself will shut those programs down. But we want a tool for ourselves to measure what's going on in our schools, to make sure that we can try to stay as safe as possible. And as we start to take steps towards reopening in this, this kind of case, coming indoors, mixing more cohorts, to have a tool for us to be able to measure that. So I just want to transition into talking about reopening. We are actively discussing with our administrative team about our plans for reopening. I hope that many of you saw the video that I put out last week. Really, and the goal of that was just to clarify some information, to recap what are the safety protocols we've been using that have been working, what are our space constraints, the key questions and challenges that we're facing, as well as changes that we've made to the hybrid. The key questions from that video, and I just reiterate them now because I know there continue to be questions about them, and I imagine there are folks here tonight specifically about that. 6-foot distancing does continue to be one of the big issues, and what difference the vaccines are going to make once those are rolled out to all staff. I know that even, as soon as today, a couple of districts have announced that they're going to be moving to more, to a lower standard of distancing. And certainly each district has its own reasons for making its choices. But I was on a meeting as soon as Monday morning, even though we were snowed in, superintendents were on a call with the Department of Health and Dr. Amler herself, and the Department of Health reiterated that now is not the time for us to be moving off a 6-foot standard because of the various variants that are going around, and because the vaccines have not fully rolled out. Her stance and the department's stance was that the current measures are what are keeping schools safe. So they urged us to remain where we are for the time being. So I think that's important to note. Vaccines are still rolling out. We've been surveying to get try to get a better sense of how far they're going out. I know starting next week will be for many school employees the second round starting of vaccines. But we do know that people have still struggled to get appointments. We're glad that the supply seems to be opening up a little steadier than it was initially. But we know it's going to take us a couple of months. So our advocacy efforts internally with the county and through my superintendent's organization with the state have been on making sure that schools have unfettered access to vaccines. Many of us have advocated for, let the schools be a site for vaccination if possible, or we'd even had conversations with the county about them setting up a window of time for the Pelham schools staff to go and get vaccinated, or different, designated times for each school. So we haven't had any progress in that direction yet, but we have been having those conversations because we see vaccines as the key to getting us on the other side of this. So that's one thing we're advocating for. We are asking for updated guidance. Again, the guidance from the Department of Health continues to be, for now, that 6-foot distancing is the standard that we should be maintaining. And that surveillance testing is another key tool that we should have in place. So as I said earlier, we're putting plans in place to start that within the next week or two so that we have that in place long term. We are looking at different steps, as I said before, how we can start moving in that direction. Right now, we're starting high-risk sports. That's one step in the direction that we see coming up. We're implementing surveillance testing, as I said. We have February break coming up, and I think the reality is we know that families will be traveling over February break. And we are hoping, again, that folks will adhere to the health agreement that we've all signed, that they will quarantine appropriately, but we are anticipating we could see a post-February break bump, as we did after Thanksgiving holiday, after the holiday break, recognizing there's no, family holidays over those weekends, so it may not be as severe, that is our hope, but we need to wait through that and see what happens. We also have, and there was an email that went out today to the elementary parents. We're looking to see if the RECTA program, we're working with them to see if they are able to set up some programming for us, potentially on our Wednesday half days, maybe even expanding to after school. I know they're also looking at February break. That will be another step in a direction. That's something we haven't done up until, we did it in the fall, but we haven't done it in the winter months. So that is another opportunity to take a step to see what happens when we add another variable to the system. If those things go well, then that's going to tell us a lot about our ability to then start moving towards, mixing cohorts at recess, starting to bring back more students into the buildings. So those are pieces that we're looking at and trying to map out what makes sense time-wise between the rollout of the vaccines, as well as taking those steps in the right direction and testing to see how we're doing with those steps in that direction. If things go well, that gives us the open door to start increasing density within our schools. A lot of questions still to be answered. As I said, guidance on 6-foot distancing, what the vaccines mean, a lot of different things. How are we going to handle lunch? How are we going to handle mask breaks if we start to increase density? A lot of those things that we're starting to wade through as a team, and we're hoping to come with more specifics of that. I do hesitate to set arbitrary date timelines. I know people want dates, but to a degree, without some of those pieces known, it's hard to set those dates. We'd rather have milestone steps and safety measures that we're going to be looking at that will help us to navigate those steps in a safe and rational way. I do want to reiterate what Jessica said. We are committed to a full return to school by the fall at the latest. I don't see anything that's going to keep us from not being back 100% by the fall, unless as a country we take a really bad turn. But I think we've all been in that really bad place and don't want to see that again. So we are committed to that. We're also going to be putting those plans in place just in case an opportunity comes sooner than that. I do want to just address a couple questions that have been floating around, and certainly I want to open up for questions from the board as well. I know other districts, some of our neighboring districts have launched plans, and they're taking a different approach, moving to a closer distancing. Again, I'm not at a place of recommending that at this point in time, given the conversations as of this week with Dr. Amler and the Department of Health. I believe following their guidance at this point to stick with 6 feet is what makes sense from a safety and health perspective. I don't know if other districts have submitted their plans to the state. The Department of Health told us that was part of our process, so if we were changing our plans, we needed to do that. I can't speak to what other districts have done. That mandate for 6 foot, the standard really comes out of State Department of Health guidance, as well as New York State Department of Education guidance. That's where the standard of 6 feet comes from, and it's, as I said in my video, the same standard we all have at the bank, at the grocery store. That's where that is coming from. So that's where those changes need to happen at the state level. That really is the big barrier that, as I see it, to us moving to more density in classrooms. We're having our principals evaluate what would the distance be at 100% capacity? What would it be 2 feet, 3 feet, 4 feet? What is that standard? So we know as guidance changes what we're able to do and how we're able to move in that direction. I think, questions have come up, if that change were made, how would the district come back? Would we launch full-time all at once? Would we phase in? The thinking right now is that it would be a phased-in approach, again, paired with testing so that we can assess if we make one move to bring in, say, kindergarten, okay, what happens? Do we see spread or not? No, good. We can take the next step. Measure, see what the change is, and phase in that way so that we're making sure to do it in a way that doesn't wind up shutting us back down as quickly as we tried to open. And so finally, a couple more questions. Staffing, we still continue to get the question of the reasons why the district decides to close an entire school versus just classes. We try our hardest to not have to shut down a whole school. At the elementary, it is a little bit easier to say put 2 or 3 classes on full remote and the rest of the building can come back. At the secondary, it comes down to staffing, and I think I'd said it in one of our prior meetings maybe. We had, I think, like 74 coverages one day at the middle school, and we got through one day, but it was not sustainable. So it continues to come down to the number of staff that are quarantined. So we've had, with updated guidance from the Department of Health, we have had fewer teachers quarantined because they've revised their definition of close contact. So we're able to be a little bit more scalpel approach as opposed to a baseball bat approach. But there does still come times whether folks are quarantined from exposure in school or the children are exposed at their own school or outside exposure where we just don't have enough staffing. That's really what it comes down to. And then finally, people ask, what does SAFE look like? We're still, we're not medical professionals. We are going to be consulting with medical professionals. The biggest piece in my mind is when vaccines are fully rolled out and the bulk of our staff are vaccinated. So we are going to be working to try to get a sense of what that percentage is. I don't know if there's a magic percentage, but we're going to be asking the medical professionals that as well and just trying to track where folks are in the process. That's kind of a summary of where we are on that. So I'll pause there and let folks ask some questions.
So good segue to what my question was going to be, which is how are we tracking how quickly our staff is getting vaccinated? Who's had the first? Who's had the second? What the schedule is? Are they reporting to us? Is it self-reporting? How does it work?
It's pretty much self-reporting right now. It can get a little tricky because it is medical information, so it's a little delicate in how we ask. I will say from our initial survey, I think I'd shared that with the board, we had over half the staff respond to our initial survey, and of that, like 84% already had their first shot, had an appointment for their first shot, or looking actively to get an appointment for their first shot, sorry. So I think there's definitely a positive culture amongst the staff that they want it. And people, principals, that's actually added to some of the absences in a funny way, but people want to get their shots and they're getting out and doing it. So we don't have an exact number yet, but we're hoping to partner to get a little bit better sense of that, whether it's through our union leadership. That's where we're hoping to get a little bit better numbers. We don't necessarily need to know the identities, but to get a better sense will help us to know when it's right to make those steps.
Right, exactly, when we reached a critical mass.
Right.
Right.
So that 80% or 50% is like 40%, right? So
And
that was a couple of weeks ago.
That was within the first week, yeah. That was right away.
Well, I'll give you some major credit because I saw, we get copied on the district emails, and you sent an email out like Monday morning, the first day of 1B. Did you know? Here's the link. Go sign up. So, within days, everybody was at least trying to get spots. So
Yeah, and I think still you see a lot of that. People, as soon as they find a site or they hear of something open, people are still sharing those sites around. And just very actively looking to do that. We don't, at this point, because the vaccines are only approved on an emergency basis, we don't have the latitude to require all staff, and certainly there will be some staff who medically can't take it. But I think overall, we've got a very positive response to it. So we're going to work to get a better number.
It would certainly be helpful to know if we were going to be advocating for like a site for all Pelham staff, right, to go get vaccinated. If
Yeah.
most of our staff had been vaccinated, it might be nice to have
Yeah, and we've
a
made that.
little updated gauge on where we are.
Yeah, and I think my understanding is the counties are coordinating distribution, so we've made that clear to Executive Latimer. Happy to come, have them come. We'll make the space, we'll make the time, do it. But I think refrigeration is a big piece of why things are having to be distributed the way they are, so. Other questions? Julia?
Can I?
Oh, I'm sorry.
Sorry.
I just wanted to add that as people are looking to get their second shot, I'm sure other people have heard, people are showing more symptoms after the second shot. And so I just kind of want to put it out there because one of the things that Department of Health is telling us is even if you're getting symptoms after the vaccine, it's still considered a symptom, and so we still have to keep them at home, and they have to go get tested and make sure that they're not positive. So, yes. And I actually specifically emailed Department of Health because many people were actually getting symptoms after the first shot, and actually I also got actually 3 or 4 of the symptoms, and I was actually quite ill, and so I ended up taking a sick day. But people are getting sick from it, and I have to then get a negative test result before I could come back. So that is a requirement still for people, so I just wanted to make sure everybody knew that this may be an issue in the next week or two as people are getting their second shots.
Yeah, we see next week is the double whammy week because it's the second shot for those who got both Pfizer and Moderna. This week will be the first week for those who got Pfizer, but next week is Pfizer second round and Moderna second round, so.
So it's very common to exhibit symptoms after your second shot.
That's what we've heard. I'm seeing some medical professionals in the audience who could probably tell us better.
Well, my wife.
But yeah, but that's what we're hearing from the medical is that there's just a more severe reaction second time around.
And
The body's
so-
ready to fight it, is what I read. You know, after the first one, it's just waiting for a fight, so.
But the vaccine wouldn't cause you to test positive. No.
Again, I'm not a doctor, but from what the information they gave me when I got my shot was that there is no virus in it,
Yeah.
so you're not going to get it from the shot. But as Julia said, when we reached, be careful what questions you ask, I guess. If someone is showing the symptoms of it, even if it's from the shot, they can't pass the daily screener, therefore they can't come into work until they get a negative test. So,
Sharon,
Jess had a quick.
are-
If you're still on vaccine, I'm kind of going off topic.
I'm going off vaccine.
all right, Jess off topic first, then Vinny.
Just going back to the return to school question, as we look at a phase-in option, if we were to do that before the end of the school year, we're still planning to keep the full virtual option that we have for families?
We haven't gotten that far, but I think we have to. I don't think we have a choice because we know that there's families that
Right,
have.
that need it. I guess that's
Yeah.
my concern, is
Yeah.
that there are families that need that option right now until
Yeah.
things are further settled.
Yeah,
Then
I think we'd
maybe
have to keep
some
that.
population wants it to be, so, okay, thank
Yeah,
you.
we just have to figure out exactly how we'd manage that, but yes.
Well, we may need to be prepared that if we change what we're doing, some more families may want to stay virtual who weren't virtual. I've talked to some
Yeah.
board presidents where that was the case. So.
Yeah, and that's what we're hearing even from some of the other communities that are talking about quickly moving to full capacity. A lot of parents they're very comfortable with hybrid at a reduced density. They're not comfortable at the idea of full capacity.
Right, there
So-
might be that situation as well.
Right.
yeah.
Right.
Well, since you stole my question on that one, I'll go to a different one. Going back to vaccine, obviously there are a bunch of security people that are here this evening as well and throughout the day that are around our children. Are they eligible for the vaccine as well?
Absolutely.
Oh, good. I'm glad to
Yep,
hear that.
anyone who's a school employee.
Okay.
Yep.
Good.
Yeah, even lunch monitors. So we're always looking for lunch monitors. That's the selling point right now. That's the big benefit we can give you. $19 an hour and you're eligible for vaccine in Group 1B.
Sign me up.
Actually, good.
Extra perk.
Great.
Leah, did you have a question? Or-
I'm pondering becoming a lunch monitor.
So what might be next steps? Because I know that as other districts roll out, how they might return elementary kids more often or roll out an increased you've laid out some of the things that you're considering, but when we might hear like some updates of what that might look like.
Yeah. I'd say, you know, we're bringing teachers, we're going to be bringing teachers into the administrative conversations and then reaching out to some medical professionals. Absolutely by the next board meeting, there should be an update on a plan for sure, if not before.
But reiterate too, I mean, the questions we got since our last board meeting about like backup plans in case we're not in person, that's not even a thought in my mind. Again, short of like major chaos in our country. And then I felt even more grounded in that when Dr. Fauci said the last thing that was going to come back was spectator sports, but he imagined even with some social distancing in place that we'd be at baseball games by summer. I said, well, that makes me feel way better about my crystal ball that I'm looking into for the fall. So
Yeah, and that's what, you know, we hope when we get to the spring, we can get back to more temperate weather. Windows can be more open. We can be back outside with lunch and with recess and mask breaks and classes. Outside was a lot easier, and we're dealing with a lot less cases in the fall. So,
do you guys have any other questions? So we'll look forward to our next board meeting.
yes,
Because I know a lot happens between two board meetings.
yes.
Um,
And then the other topic that I wanted just to touch on tonight as well, and this is, Alex was going to help me out there with the projector. I know that there's been, as you said, lots of discussion about our equity work. I've fortunate to continue to, meet with various PTAs about, just to give them a broad introduction of our equity audit. And I just wanted to take some time to anchor us back in the work that we're doing and why we're doing that work. And this is something, and I know Eileen in particular I turned to because I know she was a key piece of developing she was a board member who was one of the lead voices on developing our strategic plan. The district spent a lot of the 2018-19 school year, especially the spring, developing the strategic plan, where we surveyed, I think it was about almost 2,000 students, hundreds of parents. We did focus groups as well. And that group, we took all those surveys, and a group of about 35 community members and staff spent 2 full days working with a consultant analyzing that data from quantitative and qualitative to determine what were the key themes that they saw as a district from the feedback from our school community that should lead our next strategic plan. And out of that, we came forward with a new strategic plan, which was anchored around authentic learning, the whole child, and cultural competence. Each one of those goal areas was selected, and then a group of about at least 10 to 12 faculty then dug deeper on that goal area and defined action items. And then that's the plan that was rolled out. It was finalized into the end of 2019, rolled out in the fall of 2019. And that's where our current work on equity and inclusion and diversity is coming from. And again, for those of you who've been at the PTA meetings, you know we've been at this work since at least 2011. So this is not new to the district, but our current strategic plan has this as one of our main goals. If you go to our preamble, this really is our goal. This is maybe the new mission statement under our new plan. It's to develop empowered, adaptable, and well-balanced individuals who can contribute meaningfully to our local, national, and global society. This is our goal, and this is what we believe that intersection of whole child, authentic learning, and cultural competence will develop in all of our students. When we look specifically at the goal of cultural competence, that gets more specific in this area and drilling down to cultivate empathetic, inclusive, and an equitable school community. Equitable meaning every student has what they need to be successful. That values and encourages respect of one another, student voice, and agency for all. So students having the ability to act on, to have a voice, and then to take action on their perspectives and their voice within, and their perspective and their thoughts within the school environment itself. The guiding principle that we look at is to build a culturally competent system, not just individuals, but also a system that fosters a sense of belonging. That's one of the key pieces of what we're trying to develop in our system and strengthen their experience for all children. And I think that's an important piece for us to remember because I know that there's been a lot of debate about just different approaches, and that's part of why we're bringing the audit to our community, is to have discussion and debate. But our goal really here is a sense of belonging, success for all children, and an empathetic, inclusive, and equitable space for them. To go even deeper into the next, the action items that were defined back in 2019 that really continue to serve us well is increasing student voice and agency, as I said before. So especially looking at student voice as a main driver in our work. That was a voice in developing the strategic plan, that continues to be a voice in our schools, and a voice that we want to make sure is at the center of why we do what we do. Also, we have been looking at our curriculum instruction and resources for a number of years, so that continues to be a key area of moving forward to make sure that the curriculum itself reflects principles and values of inclusivity and equity. There's been a lot of curriculum work done, especially in the last year or so, to make sure that our libraries in particular and our learning resources are representative and reflective of our students. Increasing partnerships with community stakeholders, and that can be everyone from families to businesses to the civics to the junior league to our to Pelham Together to the Art Center, our local resources, and working together so that our students feel connected to their community and that sense of belonging. For teachers and administrators, this is really training and development so that they're skilled in culturally responsive theory and practice. So pedagogical, instructional training. And what has been a goal of ours, again, since 2019, is to build a more diverse staff for our students. And again, that's about providing certainly quality, but also representation along with that. Those are definitely a both and type proposition as we see it. Then you take that list and then we cross into the equity audit itself. You should see a lot of parallels. The first item is to develop a roadmap. That's really to extend our action steps. You remember, and I know Eileen remembers this from the strategic plan when it rolled out was designed on an 18-month timeline on purpose so that we had the flexibility to pivot as we got to the end of that 18 months. Unfortunately, COVID came at the end of that 18 months, so it's definitely changed our speed and it's changed our trajectory just a little bit. But part of that is the work of this year, is for us as a community, a school community, to talk about the audit, to talk about the strategic plan, and to identify what are the next steps for us as a community to move forward. And that's us driving that bus. And I think that's important to note because I know that there's been concerns about whether it's NYU, concerns about even doing this work in general. I think, again, it's important for us to anchor back in the strategic plan, why we do what we do, and the fact that we as a community are the ones that will be determining, and the board in particular will be determining those next steps as far as a roadmap. They've encouraged us to develop an equity policy, and that's something the board I know is considering, being the governance body of the district. That certainly will make a clear statement about where the board and the district stand with regard to equity and inclusion for all of our students. The additional points on there really do resonate with some of those points that we talked about on the prior slide. You know, connecting with networks of local districts, that's very similar to partnering with community resources. Examining professional development and building capacity, that goes back to building our skills, instructional and pedagogical skills around this work. Leveraging brilliance of young people, I see that very much in the same vein as student voice and agency, and tapping into that. And manifesting ways to hear from the community. That's the opportunity for us to continue to build those community partnerships and relationships and continue to hear from all portions of our community. I think that's one of the things that we discovered through, I've discovered it since coming to the district, just in talking with students. We discovered it in the strategic planning surveys. We heard about it this past summer. And that's one of the things that I think came in the audit. Even though it was maybe small focus groups, we did hear a continual recurring sentiment that there were certain voices that didn't feel they had a seat at the table, that felt like their voices were not heard in our community. And that's where our work around trying to create more opportunities for that is coming in. And then finally, moving to the additional recommendations that they made. This is where, you know, again, specifically we see some echoing of what was in there before. You know, I do want to address some of the concerns that, you know, that we've been hearing as well from the community as I go around to the different PTAs. You know, there's been concerns raised about generalizability of results. And, you know, I mean, I admit this, I was a qualitative researcher myself. So that is always one of the issues that you face with qualitative research. So, while admittedly it is somewhat limited in what was covered in the report, it does not discount the findings of especially those voices, in particular people that we met with and heard from. And again, that echoed what we'd seen in the strategic plan and in our own personal experiences in running the schools. And we go back to the strategic plan, I think, in my mind, to anchor what of that does resonate and does seem consistent. Additionally, one of the areas that has come up, and I know this has again been I say it's a very complex narrative. The audit did talk about Hutchinson School and some of the perceptions that have traditionally gone around Hutchinson. Again, coming into the district, I heard many of those things said, but I think that's one of the greatest examples of a complex narrative, because at the same time that there may be some negative stereotypes, there was a new school passed by our community. Both of those things are very true, and both of those things show different aspects. I think I've seen there's tremendous pride in our community's history about Hutchinson, pride in the students who have come through Hutchinson. I learned a tremendous amount when we were going through the bond process. I met so many neighbors and alumni from that school that would just stop. They'd talk for an hour, and they remember where the dentist's office was and where the music teacher was, and just such just amazing stories. Yep, yeah. Yeah, passing library books from the original public library down to the new library. So there's some amazing things there. But there are some historic assumptions that do persist, and those are things that we want to work over time to address. I know there was also some issues raised around data and looking again at identifying and addressing race-based disparities. Again, I turn back to what was echoed in the strategic plan versus what was in the audit. Where was their alignment? Where was there not? I think we're hoping to do some work on data. And this is an area that I think as a district, we just administratively definitely could benefit from just doing some better data collection, more systematized data collection, so that we can identify areas that we may need to look at, and then to do our own root cause, whether it's why are students failing, or why are students succeeding, and what are those stories telling us, and how do we use that to help all of our students do better. I don't want folks to think that we are boiling people down and viewing them as just one identity. Just a single, putting label on students. We also recognize behind every one of those numbers is a student, behind every student is a story and a real whole person. So I don't want folks to think that we're getting lost in boiling things down simplistically. Data can be used to point us where to look, but it's never the whole picture when it comes to working with students. And the other piece I think that's important in that area that has certainly been speculated upon, and I think it's worth noting, this work is not meant to lower standards. And I think folks look at some of the work that's been done around equity, and there are different approaches to it. And some of those approaches I agree with, some I don't agree with, but at the end of the day, this is not about lowering standards for any of our students. It's about providing all of our students what they need to be successful. And to do that equitably, which is going to be different for each of our students. Finally, then I'll stop talking. Diversifying hiring practice, I'm not going to spend much time on that because you see that was in our strategic plan. And I think that has been a priority for us, and that will continue to be a priority for us. And I think that we all recognize that all of us live in a diverse world, and we're all better because of being in a diverse world. And that's what we want for our kids. It's just for them to navigate and learn and appreciate and respect and grow from seeing different perspectives, being part of different perspectives, having relationships with people with different backgrounds. And that's our hope, is to provide them with the skills to do that. I'll pause there. There's a lot.
Yeah, thank you for showing this whole presentation tonight. I know you shared it with PTAs and other groups, but I think it's really important for us to look at it as a full board and have the community see it as well too. So I joined Eileen on the Strategic Planning Committee in 2018, and it was the need for inclusion of this point in the work was absolutely clear. So I think it's been clear from before that time, during the strategic planning process, and since then. So I think it is important for us to remember kind of where this came from and how the equity audit is one piece of what we're doing and one data point, and it's not all, but it is an important part of the whole.
I wanted to also add a little color because I was part of the strategic planning process prior to this one when Dr. Giarrizzo was here. And I was relatively new to the community at that point, but I was able to get a spot on that committee, and we went through the exact same process. There were surveys. The surveys came in. We all entered the room and sat at tables, and each table had a different segment of the surveys to assess. So I'm pretty sure that I had elementary school surveys, and then other tables had different ages or parents or people in the community and different surveys. And we spent a lot of time going through every single survey and noting what the themes were that came up again and again. We did that both times. And there were some extremely clear themes. We were all shocked. I don't think anybody expected it. We were hearing kids say that they saw differences in how kids were being treated on a day-to-day basis, and they often attributed it to race or who you were, different things like that. They were not massive things. We're not talking about the higher level discipline issues of, being suspended or anything like that. Nobody in that room had that perspective, that we wouldn't have known that. We were parents and teachers of individuals. They were talking about everyday occurrences. Small, people like to call them microaggressions. That's what they were talking about. That one kid would walk in and need to be sent down to get a pass for being late, and a different kid would walk in and not be sent down. They were extremely real descriptions of things that were going on. And it wasn't a couple. It was broad, and it was across all the groups. And parents also, although the questions weren't asked quite in the same way, so it wasn't as rich, but parents certainly were speaking up that they were hearing these things from their kids. So this was very different than when I went through it with when Dr. Giarrizzo was here. And it led to two very different strategic plans, but I want to convey the fact that this was very real and very new in that process. We didn't hear it in the same way 4 or 5 years prior when we did it the first time. So I want everybody to understand that. The other thing that came up that I think is very much related is that, and it's certainly related to some of the professional development, was that the older students, probably mostly high school, I don't remember middle school, expressed that they were uncomfortable expressing their views in difficult conversations in classrooms because either they knew the opinion of the teacher and they felt uncomfortable expressing different views, or they felt like the classroom didn't agree with them. And that was also so far across the board that was kind of hard to figure out what the bias was, because it seemed like so many people were feeling that way that it must be very classroom dependent. And so that led to a very long conversation about professional development and how to help teachers manage these conversations and have these difficult conversations where they can do it in school, which is such a safe place. So kids can come in and express things that maybe they can't express at home, or maybe they can't express with friends casually or family, because this is a safer place where you can kind of try that stuff out. So that was a big conversation, and I think it's connected, and I feel like everybody should know that.
I understand some of the concerns that I've heard from community members with the audit report, because I think some of it was, as I said, when we sat here and heard the report, none of it was shocking to me, because I was on the board and we approved this process, and we had a whole work session on each of the prongs of on the strategic plan. We got backup data. We talked about it at length. We spent probably 3 hours on cultural competence at the meeting a year ago this past fall. So I've seen the backup data to support why we ended up in this place with the strategic plan. I think when it comes to the audit, things like sample size jump out at people who didn't live that process with us and didn't sit at the table like you did through the strategic planning process. So I can understand how somebody who didn't walk with us on this journey have questions about the audit. I have concerns that questions about the audit try and derail the work that we've been at for nearly a decade. And so I'm glad that we have the opportunity to kind of address that here, and if there's people in the audience, just to air it and share it. But I think it's really important to know that sometimes we're trying to improve, we're trying to have access for all of our students, we're trying to ensure that all voices are heard and are here at the table, and I hear the concerns. I don't disagree with some of them. It was hard for me to read that audit, and I think this is hard work to do, and it's hard in every community that's having these conversations. And by the way, this work is happening in most communities. It's in a newspaper that I just gave to Eileen about something else. It's on the back page of it. They're doing the same work in an all-white suburban community. So it's important work, and I think it's expected that there's a lot of perspectives coming up, and I hear them all.
Cheryl, I appreciate when you were mentioning earlier, as well as Sue, touching on a very important point for a lot of discussions that I've had, a lot of emails and texts and stuff, that people didn't know what the next step was. And I told them and I assured them that the next steps are the boards. They're not NYU's, they're the boards, the next step. And this is one data point out of many that go into the plan that we continue to develop, and it's a work in process as we go along. But it is our plan, and it is not NYU's, and we will determine the next steps.
Yeah. And I totally, absolutely correct. Thank you for reiterating that. What we're hoping to do, I've got a couple more groups. I'm meeting with like Hutchinson PTA tomorrow. I'm going to try to reach out to Pelham together. We meet with a couple more groups. So we're going to be, as part of that, we have a survey that we ask people to fill out, just help us to prioritize the different recommendations. Now that you've heard of some, what do you want to, what do you think we should focus on? The administrative team is going to take that feedback as well, and us look at the audit and look at where we think this matches work that's already in place that we want to continue or start some new work, and craft a draft roadmap, and that's what we would then present to the board. So, yeah. And that we foresee taking some time, to be quite honest, because
No, I would imagine so.
the first topic of trying to bring kids back to school
Yep.
is a main focus. But this work is also going on in parallel. So we want to be thoughtful and reflective and make the right steps for Pelham.
I feel like I've heard you describe sort of how you'll take these recommendations and consider it with the strategic plan in the same way we did the last strategic plan to this one, which is to kind of look for some of those crosswalks, and places in which the crosswalk is extended because of this new audit, but put it in that context of
Yes.
that was the goal of this really, right, was to help see if there was a way we could further the work.
Yeah, yep. Especially if there's more specific ideas or areas we could drill down on better. Because that was, I think, one of the pieces of feedback we got from the initial plan is people felt like some of the items weren't maybe, they were hard to measure against, not quite, concrete. So our hope was to get some more concrete suggestions out of this. But again, they're recommendations. We can take them, we can leave them, we can take some of them, we can modify them. But again, we want to shape it to be what makes sense for Pelham.
And also it makes sense in the context of a pandemic. I
Yes.
think one thing that I've heard you say many times is there's only so many things there's only so many things we can take on at this time, and yet there's no easy time to have these difficult conversations.
Right.
So what's what are attainable goals right now versus for next year when, God willing, we're back in a more normal state?
So,
I wonder-
can I just make a comment? In reading the audit, and there's some language in there that takes one aback. But when you get to the recommendations, it's hard to disagree with any of them, regardless of how we got to that point. Reading the recommendations, I can't find anything in there to find fault with, personally. Let's say, speaking as a board member. So, how we implement them is entirely up to us.
Right.
But, I don't think anybody would argue with trying to diversify our workforce in this day and age. So I just want to put that out there because I know that some people are upset by the process, upset by some of the language in the report, and that's understandable, but I don't think it's hard to argue with where we ended up or where they ended up.
Thanks.
Well, I wanted to just add, I meant to say earlier, personally, kind of related to what John said, when I read the audit, I didn't agree with all of it. There are certainly parts that resonate with me better than others, and that extends to the recommendations. So I'm not suggesting that I disagree specifically with any of them, but I have my questions, and I think that it's I feel like the audit went out and there was an assumption that we just kind of accepted it hook, line, and sinker, but we didn't. I think it's fair to say that all of us read it and had some issues with some of the stuff and wanted to understand better where it came from and how they made some of those claims. So it's definitely not over, as a lot of people have said, and I just want to be clear that it didn't all sit perfectly.
Yeah, I think that's a really good point, Eileen. Like, I felt the same way. Like, reading it, it was difficult to read. It's been hard work to do this. And I know at that presentation, it was kind of just all put out there, and all of a sudden, and none of us really had any comments back. We were just kind of digesting too. And I mean, that's part of this process. That's part of what we need to do as a board, as Vinny's pointing out and stuff. We control these next steps, and it's a reference point, and we take from it what we need, and we grow, and we do better to reach our goals that we have set for the district. And, looking at our goals again, like every time I look back at the goals that we set from that strategic plan, I'm just very impressed and proud of what we were able to accomplish in that 18-month process there. And I just think that we can do that. And I know everyone on the board is committed to helping all of our students. And so that's really, this is just one of our steps to do that.
Very good. So I don't need to take a vote on moving.
No, you can
Okay.
just move. Yeah.
I'm going to move public comment up, Pauline, because it's already been a late night, and I think most of the people are here for the for public comment on what we've just discussed. So I just want to review the rules for public comment since we have a crowd here. So masks and social distancing, you guys are doing a great job at adhering to that, so I'll skip over. Speakers may only comment once during this session and must state their full name and Pelham mailing address for the record before speaking. 3, we ask that you keep your comments brief to allow time for others to speak. 4, vulgar, threatening, and/or uncivil language will not be tolerated. 5, importantly, neither the Board of Education nor district administrators will be responding to comments or questions during public comment. 6 is about capacity guidelines, so after speaking, I don't believe anybody's waiting, so I'll skip that one, and I guess we can move on. We were more crowded last time, so anyhow, so if you'd like to make public comment, please stand up, state your name
Do you want a
and your
motion?
mailing address.
I think we need a motion to move it up.
Cheryl said I didn't need to.
Oh, all right.
Yeah,
Okay.
yeah. Fine.
Hi, my name's Sarah Mckee. I live at 156 Cliff Avenue. I have a 5th grader and 3rd grader at Colonial and a pre-K student, and I'm currently the president of the Colonial Elementary School PTA.
Hello, everyone. My name is Alexandra Löwy. I live with my family on 513 3rd Avenue in Pelham. My husband and I have 2 girls. We both send our girls to Hutchinson, and they are 9 and 7 currently. I am the co-president of the Hutchinson PTA.
Hi, my name's Katie Caulfield. I reside at 150 Townsend Ave. I'm the PTA president at Prospect Hill, and I have a 3rd grader and kindergartner there and a 2-year-old at Mount Tom.
Hi, good evening. My name is Beth Blanc. I live at 1340 Roosevelt Avenue. I am the mother of twins, 16-year-old twins, and I am the current president of the Pelham Council of PTAs.
We are all here tonight to present a statement of unity on behalf of the Pelham Council of PTAs, which I will read. The Pelham Council of PTAs, including PTA leadership from Pelham Memorial High School, Pelham Middle School, Colonial Elementary School, Hutchinson Elementary School, Prospect Hill Elementary School, Siwanoy Elementary School, and Pelham SEPTA, is united in our support of Dr. Champ and the Board of Education and is committed to helping advance the district's strategic goal of cultural competence and the recommendations outlined in the NYU Metro Center Equity Audit. The work of the audit is grounded in cultural competence, the goal of which is to cultivate an empathetic, inclusive, and equitable school community that values and encourages respect, voice, and agency for all students. This goal is clearly defined in the strategic plan and further supported by our district's overarching mission of developing empowered, adaptable, and well-balanced individuals who are equipped to meaningfully contribute to our local, national, and global society. By uniting in our support, we are advocating for the well-being of every child and committing to work with the district in close partnership with parents and teachers to define and implement action items within our schools. We believe this focus on cultural competence exists in concert with the other strategic goals of authentic learning and the whole child, and does not take away from the district's ability to address other community concerns, like a return to full in-person learning. We acknowledge there is work to be done to make Pelham schools more inclusive and equitable. We invite the community to participate in the conversation by taking the survey to help inform how these recommendations will be implemented as we align them with our overall strategic goals as a district. Please join us in this work. Thank you.
Good evening. My name is Ian Rowe. I live at 623 Francis Street in Pelham. My wife Sylvia and I have two school-age children in Pelham, and we've been here since 2012. And having run schools for years, let me first just say thank you for the work that you do. I know how difficult it is to run schools, to be the board of a school, to manage many competing forces. And so thank you for the work that you do. I know this is all work on a volunteer basis, and it's not always thanked, so thank you. Some people, it might be helpful to share a little bit about my background. For the last decade, I've run a network of public charter schools, elementary and middle schools in the heart of the South Bronx and the Lower East Side of Manhattan. More than 2,000 students, almost all low income, almost all black and brown students. I'm very proud of the work that we did over the 10 years, and this year actually our first cohorts are graduating from college, so extremely invested in the idea of creating exceptional opportunities for low-income kids of all races. I'm also excited to share that on December 23rd, the State University of New York just approved a new model that I proposed, a character-based international baccalaureate network of high schools that'll be launching in September of 2022. Again, almost exclusively low-income and minority kids, and 100% of the kids will be expected to complete the IB program. So again, extremely focused and invested in running great schools for all kids, but particularly low-income kids of all races. Over the last few months, I've also become a member of a resident fellow at American Enterprise Institute, where my focus is poverty and upward mobility, and also a senior visiting fellow at the Woodson Center, which is a group of black scholars completely focused on improving economic, educational opportunities, particularly for low-income kids of all races. So this is something I do, something very, very important to me. As part of that work, I spend a lot of time looking at trends across the country. We're having a national reckoning on race, and many districts are doing what we're doing. They're trying to figure out how do you expose many voices on the issues of racial disparities. Many are taking on work, doing things like equity audits. But unfortunately, many of these equity audits are grounded in something called critical race theory, which is a very divisive and toxic ideology, which essentially separates people by race and says that any disparity that exists must be caused by structural racism, exclusive of any other factor. And the way that that has played out in many districts across the country, unfortunately, have resulted in lower standards, have resulted in divisive activities such as training, where white teachers are separated from BIPOC teachers, and the white teachers have to publicly reveal that they're the oppressors, and the BIPOC folks have to publicly reveal that they're oppressed. These aren't extreme examples, but these are the kinds of things that I think, for me, who's seen equity audits play out with similar amorphous recommendations, repair community harm, what does that actually mean? What are the actual steps? I'm very invested. I had the honor to meet with Dr. Champ and Dr. Thompson to speak directly about my concerns. I then shared that with the community. I think the dialogue has been very good. But now the next step is, what are we going to do? And I'm very invested in collaborating and figuring out the right steps. that adhere to our mission, inspiring a standard of excellence for all students. We're not into race reductionism. The only gap that matters is where we are today and 100% for all of our students, for all of our students. And I think sometimes we get so obsessed with particular identity characteristics, we lose sight of the overall goal. So I'm committed to work with the board, with anyone else in the community. I'm one voice, but I'm certainly inspired to continue to achieve a level of excellence for our schools, for all of our students. And I think the equity audit, there were serious flaws in the methodology, the data collection, the data manipulation, the data representation, the underlying ideology. And so I am distrustful of NYU Metro Center as a partner to continue when, in my view, they did such shoddy work that the results that they came to were based on preordained conclusions. I'm so happy to hear that it is the board that's going to make these decisions. We're not going to focus on reducing individuals to singular characteristics. Those are great things to hear, and I'm excited to join you in the effort to support. Thank you.
Good evening. My name is Pamela Arduiati. I reside at 919 Plymouth Street in Pelham Manor. I'm a mother of a 5th grader and a 4th grader in Prospect Hill Elementary School. I'm also a physician and an educator in the Icahn School of Medicine at Mount Sinai, New York City. I'm reading a letter on behalf of 459 parents in the Pelham School District. These parents and myself signed a petition on change.org in support of this letter. Dear Pelham Board of Education and Superintendent Dr. Cheryl Champ, we are a group of Pelham parents who have come together in order to advocate and advance any and all efforts to get our children safely back to school full-time and in person. First off, we thank you, the reopening committee, our teachers, and everyone involved for the tremendous work throughout these many months of the COVID-19 pandemic. We also appreciate the time taken to solicit and implement feedback from the community through the thought exchange surveys. We understand the complexity in operating during this time, and we know the board, school administrators, and our teachers have worked tirelessly to ensure that our children continue their education. By this statement, we are speaking with one voice. We need more children to have the option to attend school full-time and in person this spring, and all students full-time and in person for the 2021-2022 academic school year. All levels of government, including public health officials, as well as leading medical associations, are urging educators to make every effort to have children in school. The effects of prolonged remote school have had a devastating impact on their ability to learn and on their mental health. We have read about the numerous suicides by children nationwide, including in Las Vegas, where 18 students have taken their lives in the last 9 months, and contemplate the impact the isolation and stress has had on our own children. In addition, the leader of the education practice at McKinsey & Company estimates that the average student could lose 5 to 9 months of learning by June. Technology and internet access issues, family stresses related to illness, job loss, and the need for childcare compound all these effects. All of these negative consequences are experienced in greater magnitude by less economically advantaged families. There can be no doubt that these heartbreaking trends exist here in Pelham, and to continue this way much longer is untenable. Finally, we recognize that the hybrid learning model is a very difficult one for our dedicated teachers to successfully educate within. We understand that the shortage of space in our schools is a central issue in keeping our schools from providing full-time in-person learning to our students. Nonetheless, many surrounding districts are pushing to get at least a larger proportion of their student body more time in school. Pelham schools must make a resolute commitment of providing a full-time in-person option for students this spring and to bringing all students back by September. We must make firm plans now under the worst-case scenario that the COVID-19 pandemic is still here, the slow rollout of vaccinations for teachers and the general population continues, and that New York State guidelines do not evolve quickly enough to apply the latest evidence. We need to hope for things to change for our children and to also take decisive action now. We are reaching out to our local elected officials, including State Senator Biaggi, about ways to achieve our goal of being fully in person. We will demand clarification and update to guidance from New York State and Westchester County based on the latest data, as well as demand for direct support to vaccinate our teachers and implement a testing program if necessary. We would like the school district to support these efforts with us to the fullest extent possible. We recommend that a task force be created to brainstorm with you ways in which full-time in school can be implemented in a safe and effective way. There is an incredible wealth of resources to be found in our community members, from doctors and mental health professionals, infectious disease and public health experts, to lawyers and educators in both secondary and higher education and more. We would like to revisit AM/PM learning options, better understand the current daily hybrid attendance rate to see if in practice there's room for more children to come back for full-time in-person instruction now. We also need to revisit the idea of attaining more space and more supporting for our teaching staff. Innovative and creative ideas are necessary to meet this challenge. We understand that approvals may be required by the New York State Department of Education, which is why we're starting this effort now if necessary. We are offering our assistance in this undertaking. We want our children to remember their community, rallying strongly around their continued success and well-being during this time. Thank you for your time and attention to this urgent matter. I would also like to thank Jackie DeAngelis, who coordinated this group of parents in this collaborative and productive and non-threatening effort. We were encouraged to hear that both Harrison and Rye announced that they will start full-time in person starting in late February and March 1st. I did have questions to recite from the parents, but I think Dr. Champ addressed them earlier in the session, so thank you.
Hi, Saida Ferrara, 201 Highbrook Avenue. I will keep it brief because a lot of the things that I wanted to say are included in this letter, and I'm a signatory of the petition. I will always also say, as someone who's sat on this side of the microphone, that I appreciate all the time that you're spending here as opposed to being with your families tonight, and I appreciate all the hard work you're doing. The last thing I will say and why I'm here is that being one of the parents who sat in one of the family town halls during the work with the NYU Metro Center, maybe 50 families, or I don't have the data in front of me, but and not all families of color seems like a small subset, but had you heard the comments that these families shared about their experiences and their children's experiences, it's not small, and it needs to be addressed. So I really appreciate that you have partnered with the NYU Center, and I fully support the recommendations that they've made, and I really urge you that in parallel to working to open our schools, which I know it's a number one priority, but that in parallel to that, that you implement that the board implements an equity policy, and that these recommendations and how we implement them as a community that continue to be at the forefront of your work, which again, I know it's taking many, many hours of your time. So thank you.
Good evening, Tom O'Halloran, 333 9th Avenue, Pelham. And if you'll allow, I have an email from another parent of a senior in the school who would like me to read his since he cannot be here tonight. It'll be in the time limit. Dr. Champ and members of the board, in previous direct correspondence, we have discussed my concerns around several aspects of the Metro Center's equity audit. To date, you have been generous and thoughtful in your responses and time extended to me, so for that, thank you. In the interest of brevity, I will not go into detail on my concerns around the execution of the audit. However, I believe Ian has done that, and he posted something on Parents at Pelham, so for anybody that might be listening to this that would like to see Ian's very informed opinion, I would suggest reaching out to Ian, or I'd be happy to share it. What I would like to address this evening is my concern with the Metro Center and their subsequent engagement in the high school. In our conversations, I expressed my concern with the lack of visibility around Metro Center's initial hiring. As you pointed out, due to funding through BOCES, the board was relieved of their obligation to put Metro Center's engagement to a vote or issue an RFP, and thereby Metro Center was brought on board with neither taking place. It's my opinion that the simple loophole of BOCES funding should not relieve the board from more properly vetting a third-party vendor for something as impactful as this audit. District Policy 5411 on contracting for professional services states, the Board of Education will make certain that professional services are secured in a manner that protects the integrity of the process, ensures the prudent use of taxpayer dollars, and provides a high-quality standard of service. Not having a competitive process or even a meeting with alternate providers goes against the spirit of this policy. In our discussion since November, and in presentations by Dr. Champ, it was mentioned several times that the audit was only one facet of a multi-pronged approach, and that there would be greater discussion before proceeding with any of its recommendations. On January 19th, it was announced via a letter to students and parents that pursuant to its own recommendations, the Metro Center was engaged a second time, and now to lead the Student Equity Leader training. Again, there was no wider discussion, and to my knowledge, no RFP or vote. Quick research on staff of the Metro Center will show posts and videos that should be given consideration. Executive Director David E. Kirkland is on record claiming that President Obama is racist and has done more to aid white supremacy than President Trump. Natalie McCabe-Zwerger, who oversaw Pelham's audit, has a blog including a post stating how her newborn child was born into a venomous and racist society, as well as several other reductive and extreme theories. Some may be okay with these positions, but I am not. I do not believe these individuals should be given direct access to our student. Rather, we should be seeking professionals with forward-looking, inclusive ideas on how to build healthier communities. If we lack the resources within our current administration and staff to assist with our cultural competence goals, we need to bring in a third party in order to move forward. We must investigate alternatives. As I've mentioned several times in our previous correspondence, I am not looking to stand in the way of progress. I am not denying or ignoring that there are problems that can be addressed and improved. I speak on behalf of several people who are more than willing to come together to discuss paths forward. It is difficult to do so when any question is perceived to be an unwillingness to change or accept that there have been wrongs committed in the past. My ask is that in order to bring this community together, we start our difficult conversations from a more comprehensive assessment of what our current situation is. And if a third party's engagement is necessary, it be one other than Metro Center. In closing, I suggest that Metro Center's involvement in the Student Equity Leadership Training be paused. If the intent is to truly move forward together, I ask that the audit and the Metro Center be reevaluated and the board transparently explore alternate third parties to conduct a more thorough assessment that can be used to create a lasting change that everyone in the community can support. And this would be from Charles Millard. My son, Patrick, is a senior in the high school. He has a very positive experience for years. He has found the school to be challenging in the ways a parent would want, and he has found it to be particularly caring in ways that any parent would want. He and we are completely committed to the love of every individual as created in the image of God, and we oppose any form of racism. The respect for the individual is at the heart of our family's point of view. Critical race theory, on the other hand, believes we are all to be categorized by race and by our category as oppressed or oppressor. I have read the audit and the recommendations of the survey, and I have researched the Steinhardt organization and critical race theory. Critical race theory is one of the most divisive theories in circulation today. For example, according to the City Journal, Buffalo's curriculum now tells fifth graders, quote, "We are committed to disrupting the Western prescribed nuclear family structure." Yet the Steinhardt Center subscribes to a critical race theory. I do not understand why we would have hired them. Critical race theory expressly focuses on what divides us. It expressly makes race paramount in all analysis and seeks to expressly destroy any institution that has the power during the time of institutional racism. That would, of course, include this very school. This is evident in the audit, which does not meet any of the rigor that is required for it to be actually called an audit. An audit is based on a very small sample and does not actually specify which wrongs we are seeking to right. And the graphs are deliberate distortions as described by Ian Rowe. In short, I believe we are headed down a divisive rather than a unifying path. I respectfully suggest that the process needs to be redone. Thank you.
Good evening, everyone. Thank you. I just want to echo everyone else's thanks to you for, again, lending your time and volunteering for this. And it's clearly a thankless job. Rewarding, I hope, but thankless, I think. So my name is Pamela Arduiati. I live at 871 James Street. I have a first grader and a kindergartner at Siwanoy and a 3-year-old who thinks he's at Siwanoy. And I'm here today just to listen and to hear what the district's plan is for reopening, but I gotta say I was a little disheartened by comments that were made about not being able to speak to what the other schools in Westchester are doing to reopen by March or April. It seems to me that that's the exact opposite of what we should be doing. We should be having those conversations to find out what it is that they are doing and if there's anything that we can do to get our kids back in school full time. And to be transparent about that with parents, because the conversations that we have as parents is a little unclear. All we hear is that, Rye, Harrison, other districts are opening up. They're opening up March 1st, April 1st, and we don't really understand why. I'm glad we're discussing equity today. It's very important. I do want to raise that equity has been kind of thrown back in parents' faces a few times, at least at Siwanoy, when it comes to trying to seek resources for our children. Or, for example, my daughter who's in kindergarten, their class sizes could facilitate full-time school. They have the space, and yet they can't open full-time, in-person school for the kindergarten due to equity issues. I do think we have to look at equity in the broader context of where Pelham is compared to our Westchester counterparts. We are at a competitive disadvantage if we're not doing everything we can to get our kids into full-time school as soon as possible. So, with that, I know we said that we're following the science. The CDC just came out with guidelines saying that they're going to allow, or they would prefer that schools reopen. The American Pediatric Association just amended their guidelines, said 3 to 6 feet distancing. I think all of this should go into consideration, and it would be really helpful if the district were to articulate very clearly what its plans are and not just commit to fully reopening in the fall, but this year. Thank you.
Hi, good evening. I'm Jeff Ginsberg. I live at 9 Boulevard in Pelham. I've got 3 kids in the Pelham schools. And I'm also a member of the Cultural Competence Committee, was on the strategic planning group as well, and been involved with other things as well as my wife, Erin, has been as well. As I'm sitting here, I'm thinking about how in the schools and after-school programs that I've run for 15 years in East Harlem, how this year our staff has taken to saying that we want to greet each other using, it's sort of become a famous thing in the Maasai tribe in Africa. They greet each other, not with how are you, but, and how are the children. And I'm struck with all the critique I've heard and read in the last couple days, how little I've heard about people talking about their conversations with children, with students. I'm struck, and I push any single person on the board or in Pelham to ask themselves, have they spoken to the students? Have they heard the students? Have they heard the Black and Latinx students? Have they heard the students of color in Pelham? Were they there last spring in the protests? Have they seen their letter? Have they read the things they've said that are noted in the report? Have they gone to meetings where the students have been there and discussed this? Have they come on to many events that students have done and spoken? Have you made an effort to hear them? I get worried about the idea that in an almost entirely white room of adults, week after week, and largely online, would be claiming to know just what's going on in the schools or what the students are really feeling and what they want. I think it was quite specific what was laid out last spring. The students did an incredible job, and with a lot of support, laying out their concerns and the actions that they wanted to take. My only push on the equity audit, because I agree with the recommendations, is I have no idea why it has taken this long. I was reading an article from the 1970s in Pelham, where the black and white students were talking about how they never sit together at lunch. And then I was hearing the students here this year talking about how the black and white students never sit together at lunch. How many reports, meetings, committees, till we listen to the young people? And I can't let go this last piece about the critique of critical race theory, or the idea that race is not somehow the dominant issue here. I would push, in particular, all white people listening to this, and I've had to think about this a lot in my life and learn this in my life, to try to think through the American context. And you tell me if race is not dominant, tell me what it is. 12 million people we brought enslaved, 2 million were killed on the way here. Black people have barely still been earning the right to vote now. We have gone period after period after period in this country's history with the rules being done by race, the power being sped by race. It is not a coincidence that white family income is 10x compared to black family income. It is not a coincidence that black people are in prison at 6 times the rate of white people. It is not a coincidence that a black 8th grader in the top of their class goes to college less often than a white 8th grader in the bottom of their class. This is not, we do not need to go into every single methodology to decide there's a problem. And trust me, you shouldn't be concerned that Pelham is going to suddenly over-accentuate race. That students have been clear, we've done quite the opposite. Look at the summer reading lists. Look at the books that are chosen. Find me the black authors. Show me how we teach the history of race and the history of slavery. My son was in a class that the opening gambit in teaching slavery was asking everyone to pick which side and defend it, like it was some sort of equivalent. So we could quibble all day long about which data and how the data and the methodology and what we're going to do. It would be a disservice to our students. It wouldn't be listening to the children. Thank you.
Hi, good evening. I'm going to be brief. That was a very difficult thing to follow, Jeff. Thank you. But I'm actually talking about the coming back to school fully in person. Kristen Burke. I live at 148 Elderwood Avenue. I have 2 children, Henry and Hannah, in Colonial, 3rd and 5th grade. I've been working with Pam and Jackie on the letter and on the petition because I do feel really strongly about it. I think most of you here probably know I'm general counsel at Mercy College, and we made the really difficult decision to come back fully in person this year because our students needed to be in person, right? But Mercy is very lucky. We have the facilities. I know all of the rules and regulations. I live them every day. I was on a call before I came here tonight. Our numbers are spiking in the residence hall, so I know everything that you're going through, and I'm sorry. I feel your pain. But my biggest issue is next fall, and I am very concerned about what our contingency plans are. Yes, hopefully most of our teachers will be vaccinated, those who can, but we know our children will not be vaccinated. As far as I know, there's no vaccination for children, right? And we don't know much about the variant. And so my big concern is that everything remains exactly the same. It still is going to be the 6 feet in place. And what are our plans? We cannot continue like this. we hear all the stories, you know, the decline in our education, the mental health, the isolation, the Las Vegas stories. I really encourage people to read them. They are heartbreaking, and most of the parents didn't know how bad their kids were in isolation and the services that they weren't getting in school. So my biggest issue is and concern is we all hope to be back full-time in the fall, but what if we're not? What if we can't meet the the regulations and the guidelines, and what are we gonna do? I really want us to start thinking about contingent plans. Could we use what will be the old hutch, the tents, all these crazy things? I really think we do have to keep thinking about those and kind of expect the worst. I know I'm a naysayer as a general counsel. That's my job. That's my role every day, but that's just my advice. Thank you.
Anybody else? Thank you so much for joining us tonight and for sharing your thoughts. Okay. We'd love you to stay. We won't be offended if you want to leave either, so it's up to you. Good night, if you want. Okay, so this brings us to 4.2 Board of Education Committee reports. I can't believe that's the only spot where we are in this agenda. Okay, do we have any committee reports? Okay.
Policy will come with policy.
Yeah, we have a policy, yeah. Okay, so 4.3 is Assistant Superintendent's Update on Authentic Learning. Dr. Garcia.
So good evening. A few things I just will mention quickly. As you may know, because of the pandemic, the state of New York's Education Department is seeking federal approval to cancel the 3 through 8 assessments with a waiver. They did this last year as well, and the federal government did approve those waivers. So at this point, the Education Department is going to solicit input from stakeholders about the need for additional flexibility during this time of the pandemic. They understand that, there are extenuating circumstances again this year in terms of learning across the nation, and there is the thought that the grades 3 through 8 assessments really wouldn't give us the data, and also whether it really would give us an idea of how students are actually learning. Similarly, we're also awaiting word about the administration of New York State Regents exams. So both are on hold in terms of our understanding of the outcome, but the bottom line is that for our teachers here and across the nation, we are still preparing, we're still teaching, we're still moving forward as if the 3 through 8 tests are going to be administered, and also the Regents exams are going to be administered. But we will update, of course, the public. I'm sure the news organizations will tell us exactly what's happening before our next meeting. Another topic is that we did distribute Chromebooks, new Chromebooks, which we ordered at the outset of the pandemic, thanks to John Sabalos. A year ago, we weren't even thinking about having Chromebooks in the classroom at the elementary schools, but obviously the pandemic has changed our attitude about the use of digital devices in learning. So we were lucky that we put in an order before the big wave of other school districts across really the world were looking for Chromebooks. We received our allotment right before Christmas, and Mr. Sabalos, the Director of Technology, and Alicia Del Mastro, who has been working this year as a instructional support specialist in technology with our elementary schools, have been deploying those Chromebooks. But as part of that, the past week, they focused on 4th grade, the 4th grade students in the classes to talk a little bit about digital citizenship. So those Chromebooks are new to the classroom, right? So they're not those to take home, but they're to be used in the classroom. So they did conduct some digital citizenship learning sessions, basic things like how to use a Chromebook, but then also how to stay safe online, and then I think a little bit more deeply looking into the differences between sharing private information and personal information. So it was just an initial session that went on with all the 4th graders, and we hope to really expand that with the other grade levels at the elementary school later on in the school year. And lastly, this Friday, we're going to hold our Authentic Learning Committee meeting. That's the first of this year. The topics, really, not a surprise. One is going to be looking at how we're adapting to this hybrid learning environment with a focus on technical additions and challenges, the hardware, the back end, new applications for learning. We're going to connect that to the humanities and math and science K-12, and also looking about how we're supporting our teachers in this virtual environment, in the hybrid environment, through technology professional development, and we're going to have some teachers join us as well. So we look forward to that.
Me too.
Thank you.
Thank you. 4.4 is Assistant Superintendent's update on the whole child. Ms. Chung.
I have a couple of updates from our counseling department today. It's that time of the year already where we're looking at classes for next year. And so our counselors have been visiting classes last week, this week. They're continuing to have college meetings with families as well. And last night they had a sophomore college night with about 80 participants. The assistant director of admission from Fordham University presented on topics such as college search strategies, factors in selecting a college, updates in the college admission process. The recording for this will be up on the website soon. The civics and our counseling office is also putting together a career workshop. It's titled Politics and Public Service. This will be occurring next week on February 10th at 3 p.m. The panelists include Senator Biaggi, Senior Vice President for Communications from MSNBC, Chief of Staff to George Latimer, and a few other panelists, and the moderator will be David Joachim from Bloomberg News, Senior Editor. So I think that'll be a very interesting panel discussion for our students, and I think also very timely. So that'll be a good opportunity for them. Thank you.
Thank you. 4.5 is Assistant Superintendent's update on finance and facilities. Mr. Ricky.
We're all set. Good evening. First of all, good to see you here this evening, and certainly want to. That's all possible through the great work of our custodians and maintenance work from all the snow clearing that they did yesterday. I'm a little sore from shoveling at home. I'm sure they are too. It was quite a storm, and they put in quite a day. So we certainly owe them some gratitude for that great work. Give you a little bit of update on what's going on right now on the capital projects at Hutchinson. Tonight on this evening's meeting, we have two change orders, one requiring approval of the Board of Education for $72,000. Again, that was, I touched on it briefly at the last meeting, and that goes for the gym equipment at the Hutchinson School. This was an item that the committee and the feasibility committee and the board passed on when the project was initially bid, because everything had not been bid out for all the projects. Now that we have a better grip on what our total costs are and where we are, we're comfortable to move forward with this particular item. This includes 2 scoreboards in the gymnasium, which is great, a separating curtain, and also bleachers. And we get a little bit of a credit there for the padding on the walls because the bleachers will be covering those areas. So it's really exciting. Certainly going to be great for our schools, and we also know we're getting calls from recreation. They can't wait for it to open too. But and I know the athletic director is really excited to see that building, so we're excited about that. There's also 2 smaller administrative change orders that are on the agenda. One is for $0. It's always a nice one to bring forward to the board. Slight scope change on the facade. And then the other one is a credit for $5,000 from the mechanical. So I'm always happy to bring in those for the board for notification purposes. The work at Glover Field on the drainage pipe, which we thought was going to kind of slow down a little bit because of all the snow, was taking place today. So that's really great news for us. The contractor's moving forward. They encountered a little additional deteriorated pipe, so we're working on what that change order is going to be, but that's a good sign because we want to make sure everything is going to be in good shape as we move forward. Also last week, John Bryce, Vinny Mazzaro, Christian Hodge, John Condon, myself, and 3 community members had a virtual conversation. We talked about the bounce back wall at the Glover complex. After some of the initial work, we were envisioning a concrete wall near the field house area. The discussion kind of took place and moved a little bit forward towards a solid hardcore plastic wall, similar to something that's we've seen at a nearby school district in Bronxville. One of the members on that conversation had familiarity with it, felt that it was a high-quality wall and suitable for the purposes of what we're looking for, is like a bounce-back wall for lacrosse, so children can have the ability to increase their skills. Then after that meeting, John Condon and the two community members went and walked the site, and it looks like they've kind of come to consensus on a general area, which is great. It'll be kind of in between where the new field is and where Richie Bell Field is, if that's the final site. And it looks like we're zeroing in on that. The really great thing about this too is it can be installed or affixed to the existing fence, or we can just put posts in. So we don't have a large project with foundations and everything else that we may have had with a larger concrete wall. So it's a really great conversation, great community members, and I think it's going to be a totally great asset for the children of the school district.
And Jim, I was copied on those initial emails. Do I have it correct that it's a donation from Pelham Youth Lacrosse, or is it something that the district will be paying for?
Initially, their initial outreach was that it was something that they wanted to do,
okay,
and they were willing to do it with their materials and supplies. As we looked into it, we felt that, quite honestly, what they wanted to do would be suitable, but it just wasn't going to last for a long time because it was with wood and just materials that weren't going to last. This solution, I believe it's got a 20-year warranty on that wall, so that would be a district acquisition at that point, is the way we're looking at it right now. They certainly want to be partners in it. They've been very forthcoming and wanting to help with us, and just want to do good things for the children. So I think we're in a good spot.
Jim, could you expand a little bit on that varsity video that Cheryl was kind enough to talk about earlier?
Well, I don't have all the details behind it. As a parent, I've certainly had some familiarity with it this fall, but I think it's a program, and actually we're able to access it through a cross contract through an upstate BOCES, which is terrific because it's already on contract. And what you're able to do is broadcast those games, those varsity games. And I think the importance of that right now is with COVID, and and I know in the fall anyway, and I believe it's moving forward, visitor parents are not permitted on site. And it really creates it's a difficulty for parents who want to watch their students play sports. And in many instances, certainly in the spring now, it could be their last time playing sports for those upper level games.
And do you have any idea how many other local schools also subscribe to that?
Locally, if I recall correctly, locally, I think there was only one or two in the fall. I'm sure the list is going to be growing pretty quickly right now. As far as the setup here, I know in this gymnasium we've already contacted the electrician to hopefully get everything set up for us quickly. So we've got the camera and the infrastructure in place when we're ready to launch the program. Dr. Champ and I were communicating that this is one where we want to move fast on it because games are coming up fast.
Exactly. I mean, and I could only encourage us to continue this subscription going forward because this is a great recruiting tool for our athletes as well. Just something to think about.
That's a great point too, and like you said, when I believe you would know it too, when the student athletes are looking to go to schools, it certainly helps them in that process when they want to if they want to continue their playing career and also get into good schools.
Thanks.
If I could just add a little bit, I know Mr. Hodge, the benefit of someone like him is he's been at this for a long time, as we talked about earlier this evening. And I don't think a lot of districts locally are using it, but there are parts of the state that very heavily use the service. So I think because of his connections around the state and experience, he knows a lot of people. So I think he's seeing this as something, and I think they're seeing this as an opportunity to get more grounded in this region. So he's pretty confident we'll be happy with the service.
That's great.
Yeah, we're excited, especially through BOCES. They've already done the vetting. They've done all of those purchasing requirements that we want. So it's really in our advantage to do that. Yeah, we're excited. As you've, I'm sure, seen, the Prospect Hill work is moving along. We've got a minor change order with the drainage, which is probably better than how it was originally designed. I think the original drainage was that it would be over the ground. The modification now is that it's tied into an underground drain pipe, a storm system. So I think it's in the range of $3,000 to $4,000. Certainly felt it was reasonable. The paperwork hasn't followed on it yet. You'll see that shortly. We've communicated with the students, the parents of the students in the building, the surrounding communities. I've also outreached to the village manager. Certainly, he's aware of our process and our schedule and where we are with the project as a whole. Lacrosse wall and the interior renovations. We're certainly getting ready for the interior renovations in this building. With that, it entails we need to look for relocating our administrative office spaces, and as part of our budget preparation work and everything else, that is something that we are working with the facilities department, with Dr. Champ, and certainly bringing that information to the board. As we learn more, we certainly want to share more with you and then get direction at the same time. As you look at the personnel items tonight, we're fortunate enough, we have some more monitors coming on. You also see an oldie but goodie in there. Ralph DeMasi has agreed to certainly help us with the transition with our new safety and security coordinator. And that's to help us do that. So he's not a full-time back kind of a guy, but this just helps us with that transition. We see that happen in this month, and we'll have an opportunity for you to meet our new safety coordinator and consulting firm. I think we're going to get some really good information and some work out of them in the next few months. Recently, the comptroller released some scores about the school district's fiscal stress. Happy to report we received no designation for fiscal stress, which was great. No designation for environmental stress. Our score for fiscal stress was 0 out of 100, and it was a 5 out of 100 for environmental. So if you go to the state office of the comptroller's website, they've got a really great way to show where those stress points are and how you build those points. In the instance of environmental stress, the difference was our budget last year didn't pass by as great of a margin as it did the prior year. And I didn't have an opportunity to look and see how that compared to other districts. I think some of it may have been with the way the budget was proposed last year compared to prior years, and certainly it was a full mail budget vote and to every registered voter in the community. We know we had greater participation last year, too. And then lastly, we recently heard great news from the state, from State Department of Budget, that there was not going to be a holdback of 20% of our state funding for this fiscal year, which is really great news. I'm going to quote a little bit. So the quote was, "We will receive the money at some point." So I thought that was really great. So at some point, we're going to see, and it follows up, it says in their state's fiscal year, we will be seeing those funds once the Department of Budget releases it to the New York State Ed Department. So again, this is really great news for us, and we're working on the funding for next year, which looks like it is in place because of the federal funding. Certainly on a 2-year outlook low, these are things that give us moments of pause and concern, because we want to make sure we're building sustainability as we move forward. Yes?
Is this based on the COVID relief plan of $1.9 trillion? Is it dependent on that, do you think?
So this aid is not dependent on that, on the current relief plan. I believe it's based on the last one that was passed in December.
You said not or now?
It is not
Okay.
dependent upon any pending legislation. So I think some of it is just a matter of the state receiving those funds and then passing them through to the local municipalities and government agencies like ours. And I think that's all that I have right now, so thank you.
Can I ask a question about the Hutchinson change order? The EFIS change from the rain screen panels, was that, where did that come about from?
So I believe that came about as it was an aesthetic issue.
Okay.
Where there was one classroom where there's a beautiful view of a wall, and I think it was trying to make that wall a little bit aesthetically more pleasing than where it was. Towards the
This is up on the second floor,
Cafeteria
looking
side.
back towards the cafeteria.
Yeah, that
Okay.
southwestern room in that corner. So, and actually, I sent an email to Triton, so we're going to try to find another time for tours, hopefully sometime next week in the afternoons. And when I have that time, I'll certainly put that out there for the board, folks on the board. And if you get an opportunity to look at it, it's unbelievable.
I'd love that.
It's terrific when you drive by.
And just one quick thing. Next meeting, we're going to do we're going to see a budget overview, an initial presentation of the budget.
That's correct.
Okay.
So I think that's on the 24th.
Mhm.
So Dr. Champ will have the overview that we provide, and
Okay.
then we'll have the budget schedule where we have the normal process of the gauntlet where we run the full day of
March
budget
6th.
review.
Or line by line.
Yep.
Right? Okay. Thank you.
Okay.
So this brings us to section 7, financial reports and motions. I'd like to take 5.1 through 5.3 as a consent. Do I have a motion? Jess, thank you. Do I have a second? Thanks, Eileen. Any questions or comments?
I have a comment. Well, maybe I do. It's 5.1 to 5.3, is that what you said?
Yes.
Okay, yeah, no comment.
No questions? No comments? All in favor? Aye.
Aye.
Any opposed? Any abstentions? Okay, I'd like to take 5.4 through 5.6 as a consent. Do I have a motion?
So moved.
Thanks, John.
Second.
Thanks, Sue. John, any questions
No.
or comments?
We haven't gotten to the one I have a question about.
Okay, anybody else? Okay, all in favor?
Aye.
Aye. Any opposed? Any abstentions? So I'll take 5.7 on its own. Do I have a motion to approve high-risk sports at PMHS?
So moved.
Thanks, Benny. Do I have a second? Thanks, Eileen and Jess.
Can I ask a question on that?
You sure can? I was going to read it out loud.
Oh,
So
go ahead.
do you want me?
Can I just ask too,
Mhm.
just a reminder asking to approve this one with the attachment, with the amended, the attachment as amended, as discussed earlier,
Okay.
adding a sentence about the additional evaluation. I'm struggling for the term. Which paper is it on? As well as I know Julia had also asked Christian to add, I think, comment about getting a negative COVID test as one of the requirements of return.
Okay.
I'm sorry, I couldn't hear you.
I did speak with him about it. I think that code of conduct actually came from Department of Health. So we'll just use it as is.
Okay.
Which is fine.
All right, so then that form would just have the added statement about needing a cardiovascular evaluation upon return. That was something that Dr. Amler, in a follow-up email, sent, that this form itself needs to have that statement added. So I just ask as we approve it that it's with that understanding that that statement will be added.
Okay. So when we vote on that, that will be the understanding.
Yes. Yep.
Okay. You want me to read it first? Or you want to?
I had a question because I was looking at the sports that were on this listing here, and there is a girls ice hockey team, which is a county-wide team that is not listed here.
Ah, you are correct.
So I am just wondering if that will also fall under the same guise.
Yes, girls, yes. You know, you're correct. I'll have to go back and just clarify with him if that team is running. I assume it is, but I know
Yeah.
some districts were not participating in merged teams. I know we are,
Yeah, as far as I spoke
and I think
to
we're the bulk of the team, so,
us and Mamaroneck.
yes. Which I'm assuming they probably are too. So I guess maybe that would be something as well, an amendment to the resolution to include girls ice hockey
Right.
in addition to boys ice hockey.
And that's not an individual team for our school, it's a county-wide team.
Right, but the board should approve participation in that as
So
well.
just a quick point of order question. So generally speaking, I thought we were giving guidance by council in the past that if we're making amendments, we probably shouldn't read the entire thing aloud, because then you have to go back and correct the record. So if
You're
I'm
right.
remembering correctly. So I think
You
that
are right.
given the discussion that we've had, I think it probably makes sense to just vote on it as is with the additional sentences and then, okay.
I think you're right, I do remember those conversations.
Okay. So we'll just take a motion on it.
Yeah.
Okay.
Can I I ask a question? The girls' ice hockey, that's an aberration. Like the boys' ice hockey is a just Pelham team, right?
Oh, it's just Pelham.
Sorry?
Yes. Yeah, boys
Yeah.
hockey is
It's
just Pelham, and
Pelham.
girls is a
The girls is
merged,
the only one that is with other schools, other districts.
of this group, yes.
Yeah.
But we have things like
Rugby is
crew,
like-
rugby.
Right.
Those are also merged teams too.
Okay, so now it's getting late. Did I take my motions already?
You took a
No,
motion.
I
I
have
didn't take my
comment,
motions
question.
yet? Did
No.
I thought I did, but
So moved.
I'll take another motion. Well, no, yeah, Vinny said first,
Oh,
and
yeah,
there
I
was a
said second.
second, and Eileen and Jess tied for second. Okay, any other questions? Sorry, it's getting late. Any other questions or comments?
I have a comment.
Okay.
I have a hard time with this one. And I have a hard time with it because we're not opening our schools. And the positivity rate now is higher than it was in the fall when we didn't allow football or soccer. So I just don't understand why this was being proposed when it was not allowed in the fall, in better circumstances. So the only thing that makes me feel better about it is that we're simultaneously instigating testing. So, because if we weren't, I wouldn't vote for it. So that's the only thing that, and I know that Vinny's shooting me daggers now, that's fine. But, you know, I have a philosophical problem with it. I have a medical problem with it. But we're testing. That's the important thing. We're testing. So if it does actually become a problem, then we know what we have to do. I'm not opposed to sports. I love sports. All my kids played sports. I understand the benefit it has for the kids, but I just don't understand where this is coming from. When it was first proposed, I thought this is never gonna be approved, right? But it was at every level. So I just wanted to throw that out there. I'm going to vote for this only because we have testing in place. If we don't have testing in place, I wouldn't vote for it because I think it's dumb. To be honest.
Well, I also have to add that the fact that the board is, or a superintendent has to be the one that has to sign off on this, the onus is on us. We're approving this versus like having somebody is like the whole situation that we've been in for the last 11 months. That like Cuomo says, I'm going to kick it down to the local jurisdictions. Latimer blesses it. We have AMLR is concerned about it, and now there's another nuance that boards have to approve it. It just
it seems wrong.
everybody's uneasy about it because it's like how I felt when we reopened the first time. It's like another unknown. We haven't done this yet. So it's normal to feel the uncertainty and to hear the contradictions it has with parents who are wanting to have their kids have extra math and reading and
I
writing, you know.
completely understand their
So
frustration.
I hear where you're coming from, even though I
Absolutely.
too love sports and want my kids out of the house and being physically active. But yeah, I don't love having to do what we're doing right now, to be honest. I kind of resent it, but we're doing it, so. Does anybody have any other thoughts?
Yeah. So I hear what you're saying, John, and I also hear what the sports parents are saying, and I heard what all the parents here were saying, and I think that this is just one area where maybe we can think about the students' mental health a little bit and the ability to be on a team, to play with other kids, and to do something that feels normal, even if it only lasts for a week because we have to shut it down, is something. I think we're in a very difficult position, to your point, Jess, being the ones to have to make this decision. But this entire COVID landscape has been filled with uncertainties. We don't have the answer here. We're just doing our best. I appreciate the input from the community, but I personally think that we need to say yes on this and let the kids play for the time they can.
I agree with you. I agree with you 100%.
I
That's
want to
my
say
vote.
I agree that it totally hinges upon testing. I think it was totally irresponsible to do this without testing and then deal with all of the feedback that we've had.
Yeah, I mean, I think what, Cheryl, to your point earlier, we're having the conversations about Wednesday afternoons, we're having the conversation about sports without cohorts, and it does seem hypocritical.
Yeah.
But otherwise, we're completely bound with sticking with what we have, and that's not, doesn't seem to be what the community wants either. So we do the best we can.
Yeah.
I also think if we treat it as one test towards reopening and one step towards our eventual plan, and hopefully that plan will come sooner rather than later, that we can use it as, you know, proof that we can move forward safely, or give us more reason for concern.
I agree with that.
Yep. The way you laid it out tonight, I didn't think about it in that context, but it makes a lot of sense.
Yeah.
Do we have a plan for what amount of testing that is? Did you say that earlier? Did you say it was?
Yeah, that's something we're still kind of batting around. You know, we certainly want testing in place for our athletes because of the significant risk, but we also want to provide testing for the broader student community and staff community as well. So, you know, Julie is working with the DOH right now. She's put in the request for the tests, so we've got to see what kind of turnaround we get on that in quantity. And I think ideally, I would like to get basically a routine, just a weekly routine set up in place. So a certain amount for the athletes, a certain amount for the general population, start moving it through. So we haven't quite talked about percentage yet, but
Okay, great.
but we're hoping to.
But that will be
part
in
of that
place
will be
prior-
balanced with staffing, the ability to administer.
That would be in place prior to the sports season beginning?
Probably not. I think the earliest would be next week that we could get testing in place, and that, you know, I turned to Julie on that. We've got staff, I think, at the ready, but we need to get the tests themselves. So depending how quickly they arrive.
Is there a reason we wouldn't require testing on some level? It's so easy to get tested. The turnaround times are really good right now.
I mean, we could. That is an option. We could add it in. Part of me always worries about supply and availability.
I mean, these teams aren't that big. You know,
No.
we're not going to turn Westchester County into deficit.
How many students are on all these teams? Do we have a wild guess? 100?
Vinny, I turned to Vinny. He's probably got the best.
I'm sorry, I didn't hear.
How many students are on the teams? Hockey's probably one of our bigger teams.
Hockey.
It could be 100.
I was going to say, it's probably 30
100.
per team, right?
Yeah, it could be.
Easily.
All right,
Yeah.
so that's 4 teams,
How does that work?
150.
Yeah.
How frequently then do you test? Because the test, you'd have the test on Monday, and then you go play a game on Tuesday, and your Monday test. Oh, sorry, can you hear me? I was
Yeah.
just wondering how that testing would work if the sports are ongoing. So if students are tested on Monday and they have a game on Tuesday, then Monday's test doesn't matter anymore.
Well, I also think if we have a plan in place for prevalence testing, which is what we're talking about, right? We should stick with our plan for prevalence testing. I don't think we should add an additional testing layer on top of it. I think we should go ahead with the plan that we have.
Yeah.
It
And,
doesn't-
and that's really, Julia and Chris were just connecting, trying to connect this afternoon to figure out what makes sense.
Right.
On what cadence of that testing does make sense for athletes and for the
Because this has all been happening in real time. Really in the last, we've been expecting it, but it didn't really come until today, right? I mean, this is the first time we've seen the language.
Yes, yeah, that's true. We haven't even had the guidance for we've had it for 24 hours.
But I do think to John's point, like, we need to have this testing plan in place before we really let this go forward. I mean, I know we're authorizing it now, but what does that mean? Does that mean the kids are practicing tomorrow and we still don't know when we're going to do the first round of testing?
Yeah, they would be starting practices tomorrow. We don't have a game schedule yet, though, so it would just be our own students.
But are we talking about, like, we can get this figured out by next week, or are we saying we can't get this figured out until
I
after
think we can,
spring
as far as
break?
getting it figured out, yes. I think it's just a matter of getting the tests in hand. I think I've heard from colleagues they come relatively quickly. We don't have them in hand yet. We have nurses, Julie has been, I don't know if you want to talk a little bit about conceptually the procedure that you had been working on even before when we were talking about if we were potentially identified as a zone.
Well, prior to athletics, we were really looking at doing the testing on Wednesday afternoons, the short Wednesday afternoons, so that we're not really impacting instructional time. And we're also utilizing our nurses and our staff, and so we also don't want to be taxing them too much where we're doing it every single day after school and now they're working 10, 12 hours a day. So that's going to be it's not going to be sustainable. So what we wanted to do was utilize the short Wednesdays and possibly Saturday if we had to, depending on which cohort was in school on Wednesday, because we also don't want to have to contact trace and take out a whole bunch of people, including teachers either, and then have to close classes. So my initial planning, if we went to yellow or orange zone, was it kind of worked out in such a way that I was trying to figure out which cohort we would do on which Wednesdays. Given that now we're going to have to do this on a regular basis, that plan's probably out the window. And I'm going to have to just figure out we may have to just figure out what percentage of the athletes that we're going to do on every short Wednesday. And then on top of that, we probably need to add on additional high school students, middle school students, and also throw in the elementary school students, possibly on a rotational basis. So, I think the challenge is, again, we don't want to do this during the school day. We want to try to do this after hours. And so we'll try to do maybe 5% every week, but I think that might also be challenging.
5% every week?
5% of the in-person. That's kind of what the orange zone would have been.
So that's what,
20% a month.
how many?
20% a month.
You do 5% a week.
Which would be
5% a week is like
200 students, which would be quite challenging.
I was going to say.
Yeah. So it's going to depend on I would like to try to start next Wednesday if we can get access to because there are two parts to it. There's the testing kits that we have to get from the Westchester County, but we also have to sign up, and I've also requested to sign up for the state system where we have to log in at the end of each day that we test. We have to log in the results. And so we got to have access to that system as well. And so I'm waiting to hear back from both of them.
Are these rapid tests?
I'm sorry?
Are they rapid tests?
Yes, they are rapid tests. We're not allowed to give this rapid test to symptomatic students. This could only be for asymptomatic students.
This is
who is
prevalence testing, right?
Yes.
Yeah, I understand. Okay.
It'll be good, I know we're doing this because of sports, but as I read some of these reopening plans, part of it hinged on testing, and I know that this is something all school districts have been exploring for the last number of months as we all thought yellow and orange zones were coming our way. So just rolling this out, even if it's for student athletes at this point, I think will be very helpful if we want to talk about next steps and bringing more children back. And I keep saying, God willing, these approved at-home 15-minute, 95% reliability tests are going to come through, because that could be a game changer in all of these discussions that we're having. If you have the ability to test quickly at home and bring that to school, that might be an interesting concept. But
So when you're deciding who you're testing once a week, will that always include the athletes or no?
I think that's the part that I need to talk to Christian about,
Yeah,
because we're doing this
yeah.
on.
We've got conceptually where we're going. We haven't made the final determination.
Because athletes are not going to be 6 feet apart. They are, they're not going to have the benefit that just the standard student is going to have.
Yeah, when they're not playing, they will. They'll still have
Right.
to be masked. They'll still have to have distancing
Right.
and all those normal protocols. And even they've been doing that during practices. But when they're playing, that's exactly the high risk thing.
Right.
Is they will not have those safety protocols in place.
I think definitely every time we do the testing, a certain percentage of the athletes should be tested. So it'll be athletes plus additional students.
Okay, thank you.
As soon as we get that nailed down, we'll send more information home to the board about that. As I said, we know that this is important. We wouldn't be moving forward with a recommendation without it, for all the reasons that have been stated. We just need a few more hours to get the details worked out.
I am meeting with Christian, and I'm meeting with Christian and Ruth tomorrow, our athletic trainer, because she's going to help us with the testing as well. So we'll have a better sense of what it's going to look like probably tomorrow, or at least by Friday.
I'm assuming Christian is in support of this?
Sorry?
I'm assuming Christian is in support of this?
Yes, yes.
any other questions or comments, thoughts? Okay. All in favor? Aye. Any opposed? Any abstentions? It's the most nervous I've been voting on something in a while, but
I hear you.
it's also promise and progress. Okay, so this brings us to section 6, which is policy monitoring and governance. We have our first reading of the policy 3420, non-discrimination and anti-harassment in the district. Eileen.
Right, so we just approved this at the last meeting, or we adopted it, I should say, at the last meeting. And right at that time, we got this updated version from the policy service, and in looking at it, we felt like it wasn't substantively different. There were there's some greater explanations and definitions of things, and then there's some sort of reorganizing. The one substantive thing that was different was there's a section that defines school property and then separately defines school function. Just to note that school functions also take place virtually, so to cover that kind of thing. And other than so basically we agreed, Dr. Champ and a number of us agreed that we would go forward with this version so that we have that update, but to understand that there's nothing all that different. And I want to thank Pauline for going through and making it extremely clear to us where the changes are.
Just a question. Does this incorporate any recommendations made by the audit, the equity audit, made in the equity audit?
Not this one, no.
Okay, that's what I thought.
Yeah,
assumed.
no, this, we didn't send this to them to take a look at, right?
No, I don't believe we did. But Pauline, did you go through this one for to make the language gender neutral? Yes. Yes, so we did. That is something we've made a general part of our practice. That actually we were doing that before NYU.
Yeah.
No, I think
But
that's
that is
fine.
an
I
issue
just,
that they-
you know, there was a lot of discussion in the equity audit about
Yeah.
this policy. So
Yeah.
Well, it wasn't actually about this policy, it was about the code of conduct.
that's true, but this would also apply.
Yes,
Yes.
it certainly is in their purview, but they hadn't seen this policy because we didn't have it at the time.
Okay, that's fine. I just curious.
Any other questions or comments?
I'm just noting in the version that's on here, it's got the highlighted yellow sections.
Yeah, she noted that we're going to put in the assistant superintendent for
Yes.
curriculum and the assistant
Yeah,
superintendent for...
by position.
Yeah.
Yep, so that will be something in the next version that will look
Right.
different, just a point of information for the board.
And those two yellow sections.
Yep, and same thing. We'll carry over from our current policy.
And there's a purple section too.
I didn't get to that one yet, but yes.
Any other questions or comments?
Did you have a question, Leah?
I'm having the hardest time hearing people tonight.
I know.
Something about masks. I can't hear.
Hold
Sorry.
on.
We have been carefully looking at all of the policies with our own sense of equity as well as the voice of NYU. So.
I appreciate that. I assumed that's what you were doing. I just wasn't sure how this fit into that effort.
Well, my understanding is with some of the changes or suggestions from the equity audit that some of it is aligning it with where New York State is too, right?
Yeah.
So, okay. Okay, this moves us on to section 7, superintendent's personnel recommendations. I'd like to take a consent of 7.1 through 7.4. Do I have a motion? Thanks, John. Do I have a second?
Second.
Thanks. Vinny, who are you? Any questions or comments? All in favor? Aye. Any opposed? Any abstentions? Section 8 is people personnel services. We have a Schedule D as 8.1. Do I have a motion?
So moved.
Thanks, Sue. Do I have a second?
Second.
Thanks, Eileen. Any questions or comments? All in favor?
Aye.
Aye. Any opposed? Any abstentions? Section 9 is new business.
Crickets.
I'm like, am I hearing things? No. Okay. Eileen?
Did you want to...
I already did 10.
Okay. Madam President, would you entertain a motion to adjourn?
So moved. Do I have a second?
Second.
Thanks. All in favor? Aye.
Aye.
Any opposed? Any abstentions? Okay.